5-year-old grandson of Jerry Tarkanian suffers a stroke.
There's no doctors in town that specialize in it. There's only a few in the United States.
Now, a family who has gone through the same ordeal describes how this can happen to someone so young.
Legendary Runnin' Rebel coach Jerry Tarkanian's grandson has suffered a stroke.
And he's only 5 years old. We reached out to his family, and this is what we know. His parents rushed the little boy to the hospital this morning. And as our Lauren Rosella shows us, his family says Jerry Jr. wasn't moving and had trouble answering questions.
Shown here at a recent Runnin' Rebels basketball game, little Jerry Tarkanian Jr. sits on his dad Danny's lap, happy and appearing healthy. However, Friday morning, just weeks later, his mother would send out this tweet. Our son is getting a CAT scan now. His left side of his body is not moving. He's having trouble answering questions. He's 5. Then, our son Jerry had a stroke. He's 5, and I'm just dying inside. The family says the boy is showing signs of improvement since he was taken to University Medical Center around 4 a.m. after he complained of pain in his legs. He's undergoing testing, including a CT scan and MRI.
When you mention stroke and with a child, people just kind of give you a blank stare.
What's happening to little Jerry Tarkanian Jr. is something this father knows only too well. His son Larson had 4 strokes in the past year. He's 7 years old.
We saw an adult ER doctor who just thought he may be having a stroke. So they did an MRI, and sure enough, not only did they identify the stroke that occurred that day, but one that had occurred a few months prior.
This is Larson 8 months ago, working with a physical therapist. He had to go to a specialist at UCLA Medical Center.
There's no doctors in town that specialize in it. There's only a few in the United States.
1 year later, Larson is back in school. However, his dad says making a full recovery could take many more years. Lauren Rosella, 8 News Now.
Stroke seems so unusual in a child. We wanted to find out more, including the causes and symptoms. Reporter Mauricio Marin spoke with a doctor today. He joins us with more about strokes in children.
Good evening. There are many factors that can contribute to children possibly getting a stroke, but a family doctor we spoke with says most children get strokes because of genetic predispositions like having a family history of blood clots or an autoimmune disorder. Now, there are signs and symptoms to look out for in children, such as seizures, severe headaches, and if a child just seems out of it. Dr. Justin Maxwell says there are different types of strokes. Some are caused by blood clots, others occur because ruptured blood vessels which leads to bleeding in the brain. Once a child has a stroke, it can be a long road to recovery. However, Dr. Maxwell says kids have a greater chance of recovering better after a stroke than adults.
It depends on how massive the stroke is, where the stroke is. The good thing is that kids tend to have a much better chance of recovery with stroke because their brains are still developing, what we call plasticity of the brain, as opposed to as we age, we don't have a lot of that recovering ability.
Dr. Maxwell recommends getting kids regularly checked by a healthcare provider. It can let them examine possible risks that could lead to a stroke. Now, he suggests parents look into their medical history and let their doctor know if anyone in the family has had a stroke before. Now, the American Heart Association says when a child has a stroke, it can be very traumatic for the whole experience. So they recommend talking to a counselor about it.
Sure. A parent would be terrified with it happening.
Without a doubt.
Thanks, Mauricio.